afternoon and welcome to this afternoon's webinar as part of Health and Safety Month 2021. My name is Kate Maheras and I am the Head of Regulated Industries in Health and Safety here at WorkSafe Victoria, and I'm really proud to be hosting today this webinar, which is all around work-related violence in community care. While our program of sessions this year remain virtual, much like last year, we have the same intention, which is to keep you informed and up to date on all the information you need to make your workplaces safe. The theme this year is you learn something new every day. And today I'm really proud that this session is all around a very important topic of work-related violence. We're going to examine occupational violence and aggression as part of the community care industry. And often this hazard is seen to be part of the job. We're going to hear from a wonderful panel of employers that I'll introduce shortly that are from the disability and residential care sector. And they're going to talk about the impact of occupational violence and aggression in their very own workplaces, but also, more importantly, what they're doing to prevent it. So let's get introducing this afternoon's panel that I have here with me. Firstly, I'd like to introduce Dr. Robin Miller, who is the Chief Executive Officer at MacKillop Family Services. Good afternoon, Robin.
Hi, Kate. Nice to be here.
Great to have you here. Next, I'd like to introduce Michael Perusco, who is the Chief Executive Officer at Berry Street. Hey, Michael.
Hi, Kate.
Great that you're here too.
Thank you.
We also have Natasha Williams, who is the Executive General Manager, Residential and Individual Support at GenU. Welcome, Natasha.
Hello, everybody.
Great to have you here. And finally, Dr. Annika Jurgens, who is the General Manager, Practice Quality and Safeguards at Melba Support Services. Good afternoon, Annika.
Good afternoon, Kate.
Okay, so let's start with a little bit of background before I bring us to our panellists. The impact of occupational violence and aggression in workplaces, such as healthcare settings, residential and disability care and children's services, can be devastating. The health and safety obligations of employers in support of their workers are paramount. Work-related violence involves incidents in which a person is abused, threatened or assaulted in circumstances relating to their work. A range of sources can expose employees to work-related violence, and this can include co-workers, clients, customers, patients, people in custody, and also members of the public. WorkSafe Victoria sees high exposure to work-related violence across the healthcare and social assistance sector and are committed to addressing key issues such as significant underreporting of this issue. Work-related violence is never okay, and it can be a significant contributor to adverse mental health outcomes for workers. So we're going to start the ball rolling by coming to Dr. Robin Miller first. So Robin is a social worker and family therapist with over 30 years experience in the community sector, government and child protection. She now heads up, as I mentioned, MacKillop Services, which is an organisation that helps to strengthen and empower children, young people and families through its programs and services in out-of-home care, disability, child, youth and family support. So Robin, the first question I have is, what are MacKillop's key messages around preventing occupational violence and aggression? What are you doing and what's your organisational response?
Thanks, Kate. We have a whole of organisation response because it is such a serious problem, and prevention is the key. Prior planning prevents poor performance, and I think that, those 4 Ps, the prior planning is key. So, and relationship-based practice that's trauma-informed is what we're on about. So to have the sanctuary model in place, which we have had for many years at MacKillop now, the key underpinning of that is safety for all. So everyone having a safety plan and a self-care plan. We train everybody in therapeutic crisis intervention. We've set up a residential care governance group internally. We have a lot of data coming from every house, but the stability and the relationships of care are what are key for each young person. And when we talk about trauma-informed, it's really knowing every hair on their head, their history. And the key question is, rather than what's wrong with this young person, particularly residential care, which is the greatest sort of area of prevalence for occupational violence, it's rather than what's wrong with them, what's happened to them, and then how do we understand the triggers for them? How do we engage them, and how do we then keep track of what's working and what's not? So we do a lot of measuring, and we have built in really strong systems of accountability. So it is that whole of organisation where we don't just sort of park kids out in isolated houses. It's really wrapping around with visible leadership and all of us, me included, being part of that team and that whole team approach where kids actually feel celebrated and that they matter and that the staff feel that. And that's been particularly the case for managing lockdowns.
Yeah, I can imagine, Robin. And I love that visible leadership concept, a really comprehensive approach at MacKillop. So, Michael, I'm going to come to you with a similar question, but let me first introduce you to our audience. So, Michael Perusco commenced as the Chief Executive Officer of Berry Street in February 2018. He is the 28th Chief Executive Officer since Berry Street's establishment way back in 1877. So some history there for us. Berry Street is one of Australia's largest independent family service organisations. Berry Street believes that children, young people and families should be safe, thriving and hopeful, and works hard to make that happen. So, Michael, in a similar vein to what Robin just talked about, how would you describe Berry Street's approach to preventing work-related violence?
Thanks, Kate. Look, I think I'd describe it in two ways. Because we've taken two main approaches. The first one relates to setting the tone. We recognise that work-related violence is not an acceptable outcome in any workplace, and that includes when you're caring for vulnerable children and young people. And that is a message that's really well understood right across Berry Street. We've made the conscious decision to prioritise safety for all. So this means safety of our staff and the safety of children and young people that we care for. And I think it's really important to recognise that keeping staff safe also keeps children and young people safe. If you've got a residential care home with occupational violence occurring, that is not a safe place for young people as well as the staff. And this overall approach is underpinned by our four principles of safety: stop and connect, do it right, speak up and reflect. And we're really trying to embed with those principles a sense of the importance of safety. And I think everyone across the organisation understands that tackling OVA is our top safety priority because it's having the biggest impact on health, safety and wellbeing of our people. And having set the tone, which did take a lot of work, it's then about what are the practical initiatives that we've put in place to support staff and leaders. And just to name a few, we've implemented OVA safety leadership training for all of our people leaders in residential care. So that's about ensuring leaders work with their teams to prioritise safety, understand what safe practices look like, being able to call out unsafe practices in a strength-based way. We've done the therapeutic crisis intervention for all of our frontline staff. And in about a third of our homes, we've implemented a evidence-based model of care called Teaching Family Model. Now, we can do that in a third of homes because of the funding we receive, but this has been proven across the world to improve the outcomes for children in care and reduce the risk of occupational violence. So very much about setting the tone, but then also specific initiatives to support staff and leaders.
Yeah, thank you, Michael, for sharing some real evidence-based practice there, which we're really fortunate to hear about today. So, Natasha, I'm going to come to you next, but let me introduce you first to the audience. So, Natasha Williams is the Executive General Manager of Aged Care and Disability at GenU Coringal St Lawrence, known as GenU. She's previously worked in senior management roles in the disability accommodation services area within the state government. So, Natasha, GenU operates across disability, aged care and community services. What are your key approaches in regards to occupational violence and aggression?
I guess our priority at GenU is really to understand the person we're trying to support. And in our experience, when we can truly understand that person's needs, and for example, in relation to their communication, particularly people who sometimes can't verbalise their communication, that leads to occupational violence. So if we can understand what that communication is and what that person is trying to say to us, then often we can prevent that occupational violence. So we put a lot of effort in planning, as Robin said before, and, in the induction and orientation of staff to understand the client they're about to support. We also have a really strong foundation of what's called person-centred active support, so it's called PCAS. And our style of support with people who are ageing or have a disability around our community sector is certainly to work with somebody to go about their lives, to have a meaningful life, and not to have an approach where we just come in there and do things for people. It's definitely to do with as opposed to do for. And I guess at GenU we've got a really big awareness around safety is not just worker safety, it's client safety. Safety is about everything we do, and we certainly value the safety aspect.
Yeah, really holistic approach and really reiterating some of the things we've heard from Robin and Michael about. So let's meet our final panellist. Dr. Annika Jurgens has over 14 years experience in the disability sector. She currently leads a team of specialist practitioners at Melba Support Services with a focus on policy matters, service effectiveness and frontline practice that supports quality of life outcomes for people with disability, eliminating restrictive practices and embedding a zero tolerance approach. So Annika, tell us, how does Melba approach tackling and preventing occupational violence and aggression?
Our commitment and focus is really on embedding a positive behaviour support framework, understanding that positive behaviour support can occur around an individual as an individual process, but also as a systemic organisation-wide sort of multi-tiered approach. By focusing on positive behaviour support, it means we keep the person front and centre and their quality of life in our focus at all times, and consequently the effect is a reduction in behaviours of concern, or as we call it, behaviours of protest.
Yeah, okay. So the approach there makes a lot of sense. Tell me a bit more though around what does this actually look like day to day? So if I'm in your workplace, what are the practical things I'm seeing?
So it happens in a number of ways, starting off with a clear strategy and clear governance of the overall framework. That's pivotal. It keeps our focus, it keeps our direction. And then day to day, it sort of unpacks through having guiding documentation that informs staff, what needs to occur on a day-to-day basis, how our processes for looking to supporting the framework actually look. We also put a heavy focus on staff training in all tiers of that positive behaviour support framework. As Natasha mentioned, PCAS, person-centred active support, is a pivotal part of the tier one of the framework, focusing on person-centred planning, on engagement in how people, what their day-to-day life looks like. So staff understanding the foundations of that, but equally then providing coaching support to them, sort of walking along day to day with them. So we have invested in a 24/7 practice support line, for example, so that staff have someone to access and call at any point throughout, whether it's 10 o'clock at night or 8 o'clock in the morning, to support them in that situation when it gets to that point. And obviously part of the framework, a critical component is learning from incidents when they do incur. So having a really robust system for monitoring and review when anything does happen, looking towards continuous improvement and looking towards ways to prevent future occurrences.
Yeah, absolutely. Continuous improvement, critical in any safe system of work. So Natasha, I'm going to jump back to you. Thank you, Annika. The community care sector is pretty diverse, and we're hearing a lot of similar themes here, but I would imagine there's many common values and experiences to learn from. How does GenU communicate within the organisation around those shared learnings and really communicate broadly around what's happening?
I think particularly with age and disability, I see a lot of synergies there. So in relation to our communication, it is around unpacking incidents when they happen. So we do a lot of work on what happened, what could we have done, what was the function of the behaviour that led to the worker being injured, what was the person who was aged or has a disability trying to communicate, and also, really highlighting that no blame culture, because I think in our experience, if we start blaming people, we start saying you've done this wrong, you should have done this, it actually pushes all that reporting underground. So we've put a lot of emphasis on that communication, being open and transparent, and being able to have the, hey, it happened, you know, what can we do about it? Kind of environment.
Yeah, excellent. Thank you, Natasha. So along that thread, if I come back to you now, Michael, can you tell us at Berry Street, what's your experience with shared communications and how important that is?
So when I started at Berry Street in 2018, I was shocked that no one was talking about OVA within Berry Street or within the sector. And there really was a sense within the residential care system that OVA was part of the role. And I think that over the last couple of years in particular, it's absolutely front and centre for all of us, and that has taken an enormous amount of work. And I think there's no better example of that than the fact that we're sitting here today on this webinar talking about it. But we certainly put a lot of effort into communicating with our staff about what constitutes OVA, and that we need to know about it, and that it needs to be reported, and that we want to support staff. It took time for staff to recognise the OVA that was occurring to the point where they did record it, but we got there. And what it means now is that we have really robust data on OVA and can track trends at an organisational level, in particular areas of the organisation or with individual staff or young people. And where issues are identified, they're followed up by managers or our safety team. And I think one of the hurdles that we faced early on was the thinking that OVA was just about physical violence, and there was no thought that threats, racism, verbal abuse, etc., were also OVA, and that was particularly important to build that understanding, because knowing about it meant that we could support staff and support the young people in a different way. And I think more broadly, our safety team are now talking regularly with their counterparts in other organisations, particularly in other organisations providing residential care, where we're sharing our experiences and our learnings. And I think, it's certainly an area where no one's got all the answers. So that sharing is absolutely valuable.
Oh, I'm just so much gratitude for all that you're sharing here, Michael, and the rest of the panel. And no doubt some of your safety team are watching very proudly today as well about this conversation. So, Robin, if I can come to you and sort of look at MacKillop in this space, how do you communicate issues? How do you communicate about work-related violence, I should say, at MacKillop?
It's very important, Kate, that we've integrated it in all of our structured meetings and then in all of the clinical and supervision settings as well. So it's not just the optional add-on, it's really core. I report up on it to the board, and the executive are absolutely hands-on in reducing it. So I came to MacKillop 5 years ago. The sanctuary model was already in place, which has safety and safety plans for every young person already there. What we found, though, that there was a lack of, I think, clinical capacity to really drive the individual sort of case work and therapeutic work with each young person, and the amount of supervision that we had in place for the staff. So we've really worked on that, and we've self-funded clinical people to provide what we call reflective practice for every house every fortnight. As Michael said, the department only funds about 1/3 of the houses to have that. But that's made a difference, and we actually have seen a reduction in incidents, finally getting to a point where we can actually quantify that. The other thing we've driven is deep dive case reviews. We call it Outcomes 100, and I've been doing that I chair all of those for the last, I think, about 4 years now. We've been on that trail. So over 160 of those we've done. It's a lot of work. We have a panel. There's a lot of preparation. But what we do is really dig into, because the intricate planning around the family context, the contact with family, the schooling, if the child's being sexually exploited, and we know that increased 650% in terms of the child pornography material online. A lot of the kids all of them have access to mobile phones. So, that's a real problem in residential care. Drugs, alcohol around that as well. So, if you're not dealing with that, you're not going to reduce your OVA because the self-harming behaviour, 80% of the kids have mental illness of some description. 40% in our MacKillop cohort of 108 children have a diagnosed disability. So we're dealing with great complexity, and they've experienced, sometimes up to 50 placement changes before coming to us. We have 2 kids that have had 56 placements. The average is over 10 placements. So a lot of loss, grief and trauma within their experience in care as well as in their family experience. So really understanding and then intricately planning is core. We've done all the sort of, what I'd call normal things systemically that you do, but the other thing we've driven is quality supervision, and I audit that. We have an electronic sort of map of and recording the notes on supervision. So again, it's paying attention to each of the carers in a much more proactive way, picking up if they're looking flat, if they're looking like they need extra support. For the last sort of 4 years, we've been doing EMDR, offering that alongside EAP, but EMDR actually helps carers because we want to get the repair. These kids will be triggered, at times do act out. That's part of trauma. How do we then actually do the repair and diffuse and distract? And that's what we've really worked on with our teams, and helping staff then to recover if there have been incidents.
Yeah, absolutely. And so important, that recovery piece, I would imagine. And Robin, just to say thank you for sharing that visible leadership. You've just given us multiple examples of that. So thank you. Annika, if I can come back to you now, talk to us a bit about Melba. How do you share learnings across the business?
Much like the others, both formally and informally, sort of internally, we've also got it built into structures, routine staff meetings within at different levels of the organisation. So at staff meetings, it's critical conversation. Again, review, doing a bit of a root cause analysis and unpacking when incidents occur, but keeping that conversation live. Also, a critical component of our health, safety, wellbeing representative group meetings, and it's also discussed routinely as part of our leadership meetings. When we're looking at it from a positive behaviour support lens and from the lens of the person that we're supporting, we also have various sort of structures in place. For example, regional governance group meetings, where it's a critical focus, conversations of people's quality of life, how we measure that, how we ascertain that, how we are measuring and tracking the use of restrictive practices, for example, as well as any occurrences of occupational violence. And then that also gets reported through to the board level, which is critical. From an external lens, I think it's also important that we communicate a lot with colleagues in the space, informally through peer support networks, as well as a little bit more formally through sort of communities of practice and forums such as NDS's OHS advisory group. Any of those opportunities to engage and learn from peers about best ways or best practice to reduce occupational violence are essential.
Yeah, absolutely. And this is essentially a live demonstration of that with all of you sharing those experiences. So thank you, Annika. So Michael, I'm going to come to you on this question a little bit as well, but I also note that next Monday, the 25th of October, you're part of another Health and Safety Month webinar using systems thinking to identify holes in your system. The webinar will present a case study of a project Berry Street was involved in. How did you find working on this project? What would you like to share with the audience today about that?
Oh, look, I think just to say first, we really welcome and actively participate in the out-of-home care system OVA prevention initiative, which is, what you were referring to. I think what it does is get the key players around the table to identify sector-wide prevention strategies and programs, and what staff need, and that's staff at a leadership level as well as at a frontline level. And I think the session next week is just another way to take it forward, and it really reinforces the communication point that we were talking about earlier. There is no right answer to this. We need to share as much as we can, so that we're each coming up with a bespoke solution that suits our individual organisations.
Yeah, absolutely. We'll look forward to hearing more about that on Monday. So, Robin, if I can come back to you on this piece about working with WorkSafe, which Michael just sort of alluded to. I understand MacKillop has also worked quite closely with WorkSafe over recent years. Can you share a little bit about that with me?
Sure. Well, we are welcoming WorkSafe to come to our homes. They do. We opened 4 homes that were specially set up for COVID emergency response. So, high risk, dealing with young people who were tier 1 contacts or positive, that needed respite. So, inviting WorkSafe in to look at how we were setting that up in a way that kept everybody safe, the young people and, of course, our staff, is an example. We've earlier on, I think there were a higher number of PIN notices at MacKillop. There was a specialist intervention. I mean, we haven't had any now for over nearly 3 years, I think. So that's it's a sign of better partnership and communication with WorkSafe as well, and better accountability internally. So
that's great to hear.
Yeah, I think it's keeping that open, honest communication and continually open to feedback and demonstrating what we are doing in a very honest way. Yeah. And it's been actually really affirming when you've had the visit from WorkSafe who says, actually, I don't think you can do any more than you're doing, Yeah. And that's the feedback we're getting. So that's actually very empowering for our staff as well.
Oh, that's great to hear, Robin. And yeah, really reinforces the functions that WorkSafe have, which is definitely around that compliance and enforcement, but also very clearly around information and guidance and working with workplaces on the solutions they need to implement. So we're going to go to questions shortly, but just before I do, a bit of a hypothetical question, I guess, if you will, but I think we've got the brains trust in the room around this. I'd like to come back to each of you and just ask, what's one thing you would like to see different? What would you like to see change in this space to prevent OVA? So, Robin, I'm going to stay with you. What's one thing you'd like to see different?
Well, it's happening slowly. We've all done a lot of advocacy in the department to fund a greater range of options for the way we place and match young people. A lot of the OVA at times can be between young people or staff trying to intervene to set boundaries, etc. So that matching of young people is a critical part of the dynamic every single day because the demand is so strong. The teamwork with police is really important, and with mental health. So that would be my short to the point answer.
That's great. Thank you, Robin. What about you, Natasha? What's your one thing you would like to see change?
Probably one and a few things. So probably an acknowledgement that workplace safety applies to the worker and the client. So we need to look at it quite holistically. And I think, there needs to be a sensitive and a level of respect that sometimes when you're supporting people who are in a home or at home, that a home is a person's home, but also a workplace. So that becomes a bit of a balancing act. And I guess, we really need to support people and empower people who have such complex needs and work with them to find solutions to communicate.
Absolutely. That's a great direction, I think, to head in. Annika, what about you?
Greater focus on embedding positive behaviour support, both at an individual level as well as an organisation-wide level. That there's multiple factors that mean positive behaviour support is successfully implemented. And it's critical that as part of that, individuals have high quality positive behaviour support plans for staff to actually implement. We have to look at staff's wellbeing in each of those situations because that's also pivotal to positive behaviour support being implemented really well. So a strong focus on making sure that there is sufficient funding in individuals' plans, NDIS plans, to enable that ongoing support and implementation for staff, because we really need to walk that journey and provide that ongoing support.
Yeah, excellent. And Michael, your key change you'd like to see in this space?
So I would love to see an increase in funding in residential care up to the rate that would allow us to implement the teaching family model in all of our residential homes, because that will mean better outcomes for young people, more connection with their families, more connection with education, more autonomy in the house, and less occupational violence.
Yeah. Well, hopefully today is that platform that garners more support and more advocates for you all in this space and the very hard and important work that you all do. So don't go anywhere though. What we are going to do now is take some questions from the audience. I can see now on my screen there are questions coming through, which is excellent. And people are liking some of those questions, which means multiple people want to ask the same thing. So there's probably more questions here than we're going to get to, but we'll do our best over the next 10 minutes or so to throw it out to the audience. So let's start with, this is a pretty broad question, and I might stick with you, Michael, on this one. The quote is, "It's just part of the job." How do we go about changing this culture in care professions? So, I'm feeling like this person might be feeling that is the culture, it's part of the job, I need to accept it. How do we change that culture, that thought pattern?
So I think I mentioned when I started at Berry Street, that was exactly what we had, and it also existed in the sector more broadly. So it was a tough nut to crack. I think the fact that I went systematically around the various locations of Berry Street and spoke with relevant staff to say it is not okay really helped set the tone. And that was followed up by a whole lot of written communication. But then we got together a OVA working group with representatives from across the organisation to talk about the issue and better understand it and enable them to communicate with their team. We started reporting on OVA and then feeding that back to the organisation, so that we do a monthly OVA report that goes to the board, but it also goes within the organisation. Really what you've got to do is just talk about it and let people know that you're serious, and then it does start to shift. And we found over a kind of a 6 to 12 month period that we've got that shift. And now we don't have any problems with reporting. We're getting that robust data that I spoke about. But you've got to invest a heap of energy. And I think if the leader of the organisation's involved, that makes a big difference.
Yeah, absolutely. And all of you are demonstrating that leadership today. So the next question here is a little bit around how we monitor employees' psychosocial health. So I'll read the question. What steps do you take to monitor the psychosocial health of your employees to ensure they are not struggling with some of the more common and persistent elements of OVA, such as rude behaviour, veiled threats, insults, and these incidents are often not reported? I think, Robin, can I come to you? Because I think you mentioned that OVA is not just physical, it can be those other types of assaults.
Absolutely, and the racist slurs or the sexually, sort of disturbed comments that are there from some of the young people. So, many of them have been sexually abused or sexually exploited. So, okay, that's part of their history. How do we work with that to turn that around? So the staff really need a lot of support. Part of the thing I do with the Outcomes 100 is actually get the department involved in noting what the carers are doing that they appreciate. Because what the mental health education, the Department of Child Protection are often only here seeing the incident reports. They're not seeing the beautiful nurturing practice and the extraordinary creativity of our carers front line. So it's really important that I notice that and I get graphic behavioural descriptions of it, like the 16-year-old boy who was sexually abusive. Actually, they, brings out his doona every morning and they tuck him in and they make sure that chicken sandwich that he likes without the mayonnaise, is there. And the sort of work that actually the relationship building that actually then decreases, helps the young person's anxiety to decrease and actually accept that they need to have empathy for other people's rights. So we have rights-based education with the kids as well around, because if they've been traumatised, it shuts down their empathy. So they're, I don't care is the feeling. So, our job is to help to repair that and repair the relationships when the mistakes happen. So it's really important when we're thinking about the psychosocial health of our people that those sort of conversations happen in the context of you matter as a carer and we're here for you and what you're doing is amazing. And what do we need to do to help you to, if you're impacted, very quickly nip that in the bud. And that whole, so we talk a lot about vicarious trauma, about how we manage that, normalise it, don't pathologise the staff member, but really get in there early.
Excellent. Thank you, Robin. I knew you would be able to answer that question, so thank you for that. So this question is quite practical, I guess. Natasha, if I can come to you, the question is, are there any resources that you could suggest when looking at occupational violence? So the person asking the question says, a lot of the resources I have looked at are based out of a hospital setting. So much more of that frontline healthcare worker, but finding resources relevant has been a bit tricky. So is there any suggestions you would have, Natasha, that you use at GenU?
So particularly in the disability sector, we rely on lots of resources and often through National Disability Services. They have a great range of resources there. And I'm, happy for you to pass on my name and happy to pass those information on. However, I will say that some of the time it is about just having that safety conversation. Michael said before, talk. And I think, it doesn't matter what resources you have, and we do a lot around preventing occupational violence and online learning and face-to-face, person-centred active support and positive behaviour support. We do lots and lots of that kind of training, but I think ultimately it comes down to the safety conversation and just having that at all levels of the organisation, from the CEO down to the supervisor, and not waiting for an incident to have that conversation. What happens with what happens if this person does this? What happens when that person behaves like this? I mean, just because someone has a disability or they're ageing, you're not going to have any less of a grumpy day than you and I are going to have. But people have grumpy days. People get angry. That's actually okay. That's just being a human. Our job is to make sure that we support those people to do it in a non-violent way, and a way that's not violent towards our staff. So I think when it comes to resourcing, yes, there's some great stuff, but talking really comes down to it.
Yeah, absolutely. And I'm seeing all the panellists nodding there. So I think we are in unanimous agreement. This question, someone mentioned COVID. I think, Robin, you talked specifically about this, but the question is to you, Michael. Michael, and maybe I'll ask Annika to jump in on this as well. Has COVID changed the landscape for work-related violence and aggression? Has it changed it, or is it still the same hazard and the same controls?
We went through a few iterations. So early on, and I'm talking April, May last year, there were young people who, as Robin has said, we work with children and young people who have experienced significant amounts of trauma, and they have a whole lot of behaviours associated with that. But they were spitting on staff or, spitting on the walls, etc. And that was at a time when, we all really didn't know what this COVID thing was. So that's an example of something new that we had to deal with, and that was really, freaking staff out at the time. The extended lockdown created a lot of challenges in terms of, one, keeping the young people at home, but then once they're at home, keeping them engaged in a way where occupational violence didn't occur. I mean, lockdown was tough for all of us, and was even tougher for these children and young people. And then I think this time, the lockdown, we're seeing same sorts of behaviour, but mixed in with many more of them getting COVID. So COVID has presented a whole heap of different challenges in the OVA space, each that we've had to work through in different ways. And there's certainly been no one solution to any of them.
Yeah.
And the biggest one at the moment, of course, is our staff getting COVID. That's it's getting your PPE right. And that's another thing I could have mentioned, PPE. Jeepers. I didn't know what PPE was.
We could probably do a whole other webinar on COVID and the controls when you are working in this space that you are all in, but we won't get time to do that today. Annika, could I just come to you though, with the clients that Melba work with, what, along the lines of what Michael talked about, what's COVID meant with controlling that risk of violence and aggression?
It's been tough. It really has been tough for people. First lockdown in Victoria, people's lives were thrown into the air. Routines went out the window. So we sort of noticed an increase, but then put in place some strategies to support. So, for example, sharing activity suggestions with staff working at different sites, and increasing access to resources to create new routines for people and to create new novel and engaging and exciting days for individuals. So, as lockdowns have carried on, it's become harder and harder for us to sort of support people in those situations. We're not seeing more of an increase. We have sort of seen a plateau in the occurrence of behaviours of protest or occupational violence from individuals. So we're just hopeful that soon we'll be out of lockdown and people will be able to define new routines that they really want to engage with, because some people have actually enjoyed having more of a quieter pace during lockdown. So it's meeting individual needs and them defining what quality of life looks like for them.
Yeah, absolutely. Now, I had suspected this might happen, but we have reached the end of the webinar. So I will wrap up this Q&A. Thank you to Robin, Michael, Natasha and Annika for your terrific responses to those questions and your presentations today. This is where I will say farewell to you four. So thank you so much.
Thank you. Thank you.
And to all of our viewers tuning in today, this is the end of this webinar, and I'd like to thank you for registering your interest and joining us in this conversation. We haven't made it to all your questions, but we do have a great lot of resources on the WorkSafe website where you might find guidance and tools and support that can answer the questions you've had and you can take back to your workplace. Work-related violence is never okay. We've definitely heard that from our panellists today. But the good news is everyone has a part to play in keeping our magnificent community workers safe when they go to work every day and the people that they care for, as you've heard from today. We hope you found this session interesting and informative. This webinar has been filmed and it will be available on our website next month, so you can watch it back and share it with others that you think might also be interested. Remember, if there is something urgent that you need support or advice on, you can call the WorkSafe advisory line or you can visit our website, and we also have after hours support, and all of those details are on our website. On the screen shortly, you'll note a short list of all of the context and sort of information we've talked about today that you might find helpful. And if you've got any further requests for information, as I said, please get in touch with us, as we'd like to help you and your workplace. Thanks so much for tuning in today. I hope everyone stays safe out there. Thanks.
Thank you.